Hey guys, today's topic is drug addiction. So, first of all, we will try to know what is the definition of a drug. What does a drug mean? So, drug is defined as a chemical prescribed by prescribed by a physician for the treatment for the treatment of a disease of a disease or ailment for the treatment of a disease or ailment and is to be is to be withdrawn after the desired effect after the desired effect has been achieved. So we say drug is a chemical which is prescribed by a physician for the treatment of a disease or ailment, and this drug needs to be stopped. Its intake should be stopped after the person gets cured or after the desired effect is achieved, right? So this is the definition of a drug. Now these drugs, there are two types. Drugs are classified into two types. One of these drugs types is known as non-habit forming drugs. Non-habit forming drugs. And its another type is known as habit forming drugs. Non-habit forming drugs are those drugs which, when taken by a person for the treatment of the disease or ailment, then these drugs do not cause any physical or psychological dependence on them. The person doesn't crave anymore for intake of that drug. So person doesn't become dependent on that drug. So those drugs which don't lead to physical or mental dependence on them, we call those drugs as non-habit forming drugs. For example, paracetamol. Paracetamol is an analgesic, or we give it as an antipyretic. So when a person has a headache or person is suffering from fever, he takes paracetamol, he gets okay, then his body doesn't crave for, his body doesn't want any more paracetamol. So he doesn't develop any physical or mental dependence on this drug. So this paracetamol, it is a non-habit forming drug. Similarly, we also use antibiotics. We use ofloxacin or nidazole, right, or other antibiotics. When we take them, we get cured. Then our body doesn't demand. Our body doesn't demand them anymore. So those drugs are known as non-habit forming drugs. But there is a class of drugs which are prescribed by the doctor for the treatment of a disease or ailment. But once the person gets cured, his body, after being even cured, his body demands the drug more and more. So these drugs, they have an effect on the mind of a person. They have an effect on the body of the person. So the person shows physical and mental dependence on those drugs. Those drugs are known as habit forming drugs. For example, you might have heard about codeine phosphate. You might have heard about this diazepam. You might have heard about chlordiazepoxide, right? So those drugs which cause physical and mental dependence, those drugs are known as habit forming drugs. So these habit forming drugs, they cause physical and mental dependence. Mental dependence. So these drugs are known as habit forming drugs. So we classify the drugs into two types: non-habit forming drugs and habit forming drugs. So we call these habit forming drugs as addiction causing drugs. So these cause addiction if they are misused they are misused. Their misuse is known as abuse. We mostly use the term drug abuse. So these drugs, they are beneficial, but when we make their misuse, so that is their abuse, right? So these drugs, they cause addiction because they cause physical and they lead to physical and mental dependence. So these drugs are known as addiction causing drugs. And we are today going to discuss about these addiction causing drugs. So we are going to discuss about what is drug addiction. So physical and mental dependence on these habit forming drugs is known as drug addiction. So what is drug addiction? Drug addiction is the physical and mental dependence on certain drugs. So if a person becomes physically and mentally dependent on some drugs, so this phenomenon is known as drug addiction, right? Now we will classify these habit forming drugs, these addiction causing drugs into their different categories. So these addiction causing drugs, they are classified into following major categories: sedatives and tranquilizers, opiate narcotics, opiate narcotics, stimulants, and hallucinogens. So we classify these habit forming drugs into four main categories: sedatives and tranquilizers, opiate narcotics, stimulants, and hallucinogens. So first we will learn about sedatives and tranquilizers. What are these sedatives and tranquilizers? These sedatives and tranquilizers, they are actually known as anxiolytic drugs. Anxiolytic drugs. They lower anxiety and tension. And tension. These sedatives and tranquilizers, they are known as anxiolytic drugs or anti-anxiety drugs. So they lower anxiety and they lower tension. So if a person is mentally disturbed, he is not able to sleep, doctor prescribes him an anxiolytic drug, a sedative or tranquilizer. So this lessens the functional activity of his central nervous system. These drugs, they give a feeling of calmness and relaxation. These drugs, they give a feeling of calmness and relaxation. And they induce sleep. They lessen these sedatives and tranquilizers. They lessen functional activity. Functional activity of central nervous system, giving a feeling of calmness, relaxation, giving a feeling of calmness, relaxation, lower tension, and induce sleep, and may induce sleep. So they make a person to rest properly. Everybody in this world is perturbed by one or another problem. But some people, they are highly disturbed because of their domestic problems or because of their financial problems or because of some other problems, right? So those disturbed people, they feel very difficult to sleep. They are not able to sleep properly. They always remain in a state of tension. which raises their blood pressure, which makes them restless. So when they visit a doctor, doctor prescribes them a sedative or tranquilizer. This sedative or tranquilizer, it lowers the functional activity of their central nervous system. So it gives them a feeling of calmness, relaxation. It lowers their tension and it induces sleep. So those persons, by the use of sedatives and tranquilizers, they are able to take appropriate rest. They get rid of their anxiety and tension, right? So they are very useful drugs. They are very useful drugs. But certain people, they make misuse of these drugs. They take them without any appropriate reason. They just want to sleep for longer periods of time. You know, everybody is supposed to face the hardships of daily life. So everyone faces the hardships of daily life, right? But certain people, they want to escape these hardships of daily life. They resort to escapism. And to escape the hardships of daily life, they do not look for solutions. They simply take the shortcut. They take these sedatives and tranquilizers. And as they relieve the tension and anxiety and induce sleep, so they try to rest at home. They do not want to find the solutions. They simply want to exit, to avoid those hardships by taking these sedatives and tranquilizers. So they take sedatives and tranquilizers, and they remain at home without any tension, without any this anxiety, and it induces sleep, and they try to rest at home, right? But this is not the permanent solution. This spoils their life. Those persons, they become then habitual of these sedatives and tranquilizers because they have not sorted out the actual problem. They have not found the solution for the actual problem. They have taken a short route. They have escaped the problem, right? So this escapism, it spoils their life. It makes them habitual of these sedatives and tranquilizers. It makes them addicted to use of sedatives and tranquilizers. So every person in the world is having one or another problem. And the solution for those problems is to work hard, try to solve those problems, but there is no solution to escape the problems by taking these sedatives and tranquilizers, right? The examples of these sedatives and tranquilizers, they are, we will see the examples of sedatives and tranquilizers. Examples of sedatives and tranquilizers include benzodiazepines and barbiturates. So benzodiazepines and barbiturates, they are the examples of sedatives and tranquilizers. These benzodiazepines, they include drugs like chlordiazepoxide, they include drugs like diazepam, lorazepam, nitrazepam, clonazepam, clonazepam. So chlordiazepoxide, diazepam, lorazepam, nitrazepam, clonazepam, they are all benzodiazepines. Similarly, we have got some barbiturates. These barbiturates, they are also known as sleeping pills. They are known as sleeping pills. And these barbiturates, they include barbital, allobarbital, amobarbital, phenobarbital, so barbital, allobarbital, amobarbital, phenobarbital. They are the examples of barbiturates, right? Barbiturates, they are commonly known as sleeping pills. So these drug addicts, they take these barbiturates. These barbiturates, they induce abnormally deep sleep, and they sleep all the day after taking these pills. So they become useless persons. When they sleep all the day at their home, so they are considered as useless persons. They get away from the reality of the world. They do not, they are not able then to face the problems of the real world, right? So they become addicted and they remain of no use, right? Similarly, benzodiazepine, chlordiazepoxide, diazepam, lorazepam, nitrazepam, clonazepam. They are advised for patients who are suffering from anxiety and tension. But some persons, they take them without any anxiety and tension. They want to take a rest at home and do nothing, right? So this spoils their life, right? And these drugs, they have also got adverse effects on their brain and this nervous system, right? So these drugs, then they induce neurosis in them. Neurosis means inflammation of the neuron. This may cause psychosis. This may cause, these drugs, their abuse may cause schizophrenia, right? So they have got various side effects. So this category of drugs is known as sedatives and tranquilizers. Although they are useful, they are prescribed by the doctors for some medical conditions. They are prescribed by doctors to relieve anxiety and tension, to provide feeling of calmness and relaxation to certain people who have become agitated or who are suffering from severe anxiety and tension, right? So these drugs, they should not be taken by your own self. They should not be taken without any medical prescription, right? So they are useful drugs and their misuse leads to their addiction. Then we have got another class of drugs, opiate narcotics. So first we will discuss what is a narcotic. Narcotic is a substance which benumbs or deadens a person. Narcotic is a substance which benumbs or deadens a person, causing loss of feelings or even paralysis. Or even paralysis. So narcotic is a substance which benumbs or deadens a person, causing loss of feeling or even paralysis, right? So why doctors prescribe these narcotics? These narcotics actually, they are very effective analgesics. Analgesics. They are very effective painkillers. Painkillers. So they kill the pain. So whenever a person is suffering from a severe pain, a doctor may prescribe him some narcotic drugs. The doctor may prescribe him some drugs which are considered to be narcotic. So since they are very efficient painkillers, so uh, they have they are very useful. They are very useful. But their abuse, but their misuse has now led to their ban. Those persons who were suffering from bronchitis or pneumonia, they have severe chest pain. Doctors used to advise them to take circodin cough syrup. In that circodin cough syrup, there was an ingredient known as codeine phosphate. This codeine phosphate, it mitigated the pain of the bronchitis. It lowered the inflammation of the bronchioles. It lowered the inflammation of the bronchioles. So it gave them a feeling of calmness. It gave them feeling of this relaxation, right? But some people, they are taking this codeine phosphate without any prescription. This codeine phosphate, it induces sleep. It causes this addiction, right? So some people, they are taking this codeine phosphate without prescription, and this has led to its misuse. And nowadays, codeine phosphate has been banned from in any drug. Nowadays, no, you can find no cough syrup in the market with codeine phosphate. Codeine phosphate was a very useful substance. It used to lower the pain of the bronchitis. It used to soothe our bronchioles. It lowered inflammation. It lowered pain, right? But nowadays, the drug has been banned. The drug use has been banned because this is being misused by certain miscreants, right? Where from these narcotics are obtained? These narcotics, they are obtained from. These narcotics, they are obtained from unripe, unripe poppy or poppy plant, Papaver somniferum, Papaver somniferum. So these opiate narcotics, they are obtained from the unripe poppy plant, Papaver somniferum. Papaver somniferum. This poppy plant, it develops this capsule. Then incision is given on its surface. This poppy plant, it develops this unripe poppy. Then incisions are given on its surface. And through these incisions, it exudes latex. It exudes latex. It exudes latex. This latex, it is collected and then it is processed in different methods. It is processed by different methods. And from this latex of this poppy plant, right, different narcotic drugs are formed. For example, opium is formed from it. Opium may be formed from it. From this latex, different drugs are formed. Drugs like opium, methadone, codeine, pethidine, or this heroin, etc. Heroin may be formed from it, right? So this opium, methadone, codeine, pethidine, heroin, or brown sugar, they are all the narcotic drugs. They are all narcotic drugs, and they are all obtained from this unripe poppy of the poppy plant, Papaver somniferum, right? So these drugs, they lessen the functional activity. They depress the central nervous system. These drugs, they depress the central nervous system, and they block the pain receptors. They inhibit the pain receptors. So when they depress the central nervous system and inhibit the pain receptors, so the person gets rid of pain. The person gets rid of pain, and they have also got some this anti-inflammatory effect. They can also lower the inflammation, right? So these are very useful drugs. A person who is suffering from cancer is given this opiate narcotic, right? A person who is suffering from cancer pain is a very severe pain. No other painkiller works against that pain. That pain is only subsided by the use of these opiate narcotics, right? So they are very useful drugs, but their misuse has led to their ban, and their misuse is spoiling the life of many people, right? So, what are the harmful effects of these opiate narcotics? What does it cause if it is taken without a medical prescription? Misuse or addiction of narcotics drugs. It leads to many disorders. First of all, it causes mental derangements. Their misuse causes mental derangements. Addiction of narcotics. It leads to mental derangements. It causes neuritis. Neuritis means inflammation of the nerve fibers. Inflammation of nerve fibers. Nerve fibers. It may cause neurosis. In neurosis, a person suffers from anxiety state. Anxiety state. A person suffers from reactive depression. A person suffers from hysteria. Hysteria. Uncontrolled emotional state. Emotional behavior. So misuse, abuse of narcotic drugs causes mental derangements. A person becomes mentally unstable. It may cause neuritis. It may cause inflammation of the nerve fibers. So the person may feel pain in the muscles in the body, right? A person may suffer from neurosis. A person becomes mentally disturbed. He always remains in anxiety state. The person always suffers from reactive depression. He seems to be engrossed with himself, right? A person may suffer hysteria. A person may show bouts of uncontrolled emotional behavior, right? The long misuse, the long use of these opiate narcotics, it may cause then psychosis. Psychosis. This psychosis, it is characterized by loss of ability, loss of ability to think. A person cannot think properly or respond emotionally. Respond emotionally. A person does not respond emotionally. It causes loss of ability to remember. Loss of ability to remember. A person loses his memory. Loss of ability to remember the things or events. So a person suffers from loss of memory. A person is unable to communicate. Ability to communicate properly, that is lost. A person does not interpret reality. Loss of ability to interpret reality. A person cannot interpret a reality, or the person does not behave properly. So, in short, we say in psychosis, a person becomes insane. A person becomes insane. Or we can say he is just like a mad person. A person behaves like a mad person, right? So, psychosis is a very severe mental disorder and it is caused due to opiate narcotics, right? If a person makes misuse of opiate narcotics, the person may suffer from psychosis. He may suffer from the loss of ability to think. The person is not able to think properly. The person is not able to respond emotionally. The person is not able to remember the things. He loses his memory. The person is not able to communicate properly. The person is not able to interpret reality. He is not able to perceive the reality, the person is not able to respond properly, or the person is not able to behave properly. So the person becomes just like an insane person, right? The person almost becomes mad. The person almost becomes mad. This condition is known as psychosis. These opiate narcotics, they may also cause schizophrenia. Opiate narcotics, they may also cause schizophrenia. Schizophrenia. That means a disorganization. Disorganization. Disorganization of personality. So a person hardly bothers about himself. The person is not concerned with what he has put on, how does he look, right? So he is not conscious about himself, and he remains in a state of that madness, mad like situation, right? So this schizophrenia, it causes disorganization of the personality. The person may visit his office regularly, but how he should be dressed in the office is no concern to him. The person may do his domestic work, but how he should behave, how he should look like, that is of no concern to him, right? So his personality gets distorted, right? So this is the effect of these opiate narcotics. These opiate narcotics, they have very severe withdrawal effects. If a person is taking, if a person was using these opiate narcotics, if you try to stop him taking, if you try to stop him from taking these narcotics, he will immediately show withdrawal effects. The person may immediately show withdrawal effects. So what are its withdrawal effects? So if you find any drug addict, never stop him at once from taking those drugs. Because if you stop him at once from taking the drugs, he may suffer from withdrawal effects, and these withdrawal effects may kill him. So if you find any drug addict, you should refer him. You should advise his family members to take him to a rehabilitation center. At rehabilitation centers, they lower their drug dose slowly, till their body gets adjusted. If we stop their drug at once, they may suffer very severely, and that may kill them, right? So the withdrawal effects of these drugs, it causes severe abdominal pain, severe abdominal pain, muscular pain, muscular pain, cramps, vomiting, or sometimes cardiac arrest, or sometimes cardiac arrest. So if anyone has become a drug addict, his drug dose should not immediately be stopped. He should be referred to a rehabilitation center. At rehabilitation center, over a long period of time, his drug dose is slowly minimized till his body adjusts to that minimized drug dose. If you stop the drug at once to him, he will develop withdrawal symptoms, and because of withdrawal symptoms, he may not be able to bear this pain, and the person may suffer a cardiac arrest and he may die, right? So it is these withdrawal symptoms which make these drug addicts criminals later on. So these drugs, they are very costly. In the beginning, these drug peddlers, they provide them these drugs free of cost till they become habitual of them, till they become dependent on them. Once they feel that the person has now become dependent, he has now become the drug addict, they ask him for money, right? He could not withstand the craving for the drug. So he tries to look for the money. He borrows from his friends. He borrows from his family members. He borrows for some period of time. After that, the friends and family members, they refuse to borrow him any, lend him any money, right? Then he starts stealing small objects from his home. Then he makes the big thefts, right? Then he falls in the hands of those gangsters, and in return of money, they ask him to do any criminal activity, and they use him as a source, right? So it is the withdrawal symptom which leads them towards the crime, right? So one should not stop the drug immediately to a drug addict. He should be referred to rehabilitation center, where slowly the drug dose may be reduced. So this was about opiate narcotics. Now, after opiate narcotics, there is another class of drugs that is known as stimulants. These stimulants, they increase the functional activity of central nervous system. So act as mood elevators. They act as mood elevators. So increased they lead to increased self-confidence. They increase the self-confidence of a person. They give a feeling of excitement. They increase alertness of a person. And they cause loss of appetite. Loss of appetite. So they overstimulate a person. They overstimulate a person. So stimulants are those drugs which increase the functional activity of central nervous system. So act as mood elevators. They make a person overconfident. They cause excitement. They increase the alertness, and they cause loss of appetite. So a person remains in a state of high alertness and excitement, right? That is why we call them as mood elevators. These stimulants, they include the drugs like codeine. Sorry. They include the drugs like cocaine, cocaine, and caffeine. Stimulants include the drugs like cocaine and caffeine. You know, we obtain this cocaine from the coca plant, erythroxylon. We obtain this cocaine from the coca plant, erythroxylon. And caffeine is found in the coffee, right? You might have experienced it in your exam days. So when you are making the studies till late night, then you take a cup of coffee. As you take a cup of coffee, you become refreshed, right? You feel refreshed. Your alertness increases, your concentration increases, right? So you feel awakeness. So this awakeness, this increased alertness, this refreshment of the brain, this is because of the caffeine which is present in coffee, right? So some persons, they make misuse of this cocaine. This cocaine is taken in the form of powder form or in the form of injectable drugs, right? So some persons, they cause misuse of cocaine, and this misuse of cocaine, it leads to them to paranoia. It causes paranoia. It causes paranoia. This paranoia, it is characterized by delusion of persecution. It is characterized by delusion, delusion of persecution, persecution, or delusion of delusion of grandeur. So paranoia is a state of mind where a person always feels delusion of persecution. That means he always is in fear of being persecuted. He thinks that this person is going to kill me. He thinks that that person is making conspiracy against me. So he feels that everyone is trying to harm him. So this feeling of being harmed, trying to be harmed by any person, this is known as delusion of persecution, right? So the person develops a state of mind where he feels that everyone is his enemy. Everyone is making conspiracy against him. Everyone wants to get him executed. So this is known as delusion of persecution. Or sometimes they develop delusion of grandeur. What is this delusion of grandeur? They get a false perception of being some extraordinary person. They treat themselves, they feel themselves that they are VIPs. They are having a high esteem, right? So that is known as delusion of grandeur. So either they develop delusion of persecution or they become fearful or they think themselves that they are superior. They are very much superior and everybody should respect them. So they start working in that particular manner, right? As if they are very important personalities. So that is known as delusion of grandeur. They may also suffer from some withdrawal symptoms. If the drugs are not given them, if the drugs are not given them, they may suffer from depression and anxiety. The withdrawal symptoms of stimulants include depression. When they do not get the drugs, they become depressed, right? They develop anxiety and they become restless. They develop a feeling of restlessness, right? So stimulants are those drugs which stimulate our central nervous system, giving a feeling of self-confidence, giving a feeling of excitement, increasing alertness, and giving and decreasing our appetite. So one does not bother about his appetite, right? So in this condition, a person is grossly overconfident. The person becomes overconfident. Then it is prolonged use. The prolonged use of these stimulants, cocaine and caffeine, it may lead to paranoia. In this paranoia, a person becomes either fearful about the other people. He starts thinking that they are going to kill me, they are making conspiracies to kill me, or he develops the delusion of grandeur, or he feels himself superior to others, right? If the drug is not given to them, then they suffer from withdrawal symptoms. What are the withdrawal symptoms of this cocaine and caffeine? You should take rest. So it causes then depression, anxiety, and restlessness. So that is about the stimulants. So these stimulants, they are very useful substances. We can take them to our advantage, but their prolonged use, but their misuse, their dependence may cause this depression, anxiety, restlessness. It may cause paranoia, and the person may become a paranoid. So that is about the stimulant. Now there is another class of drugs known as hallucinogens. These are the drugs which change perceptions and thoughts. They change perceptions and thoughts. The person who uses these hallucinogens, develops false perceptions, and he claims hearing colors and seeing sounds. These drugs, they change perceptions and thoughts to such a degree that the person claims hearing colors and seeing sounds, right? Or we can say inanimate objects. Inanimate objects seem animate to him. Inanimate means non-living. Non-living objects, they seem living to him. So his thoughts and perceptions are changed to such a degree, right? So these drugs, which change perceptions and thoughts, they are known as hallucinogens. We also call these drugs as psychedelic drugs. Psychedelic drugs. Because they have got a very severe effect. They have got a strong effect on cerebellum and sense organs. So it is because of their strong effect. It is because of their very severe effect on cerebellum and sense organs that his perceptions and thoughts are changed, and he claims to hear the colors and see sounds, or he to him inanimate objects seem to be animate, right? So his perceptions and thoughts are altogether changed. So these hallucinogens, they include drugs like LSD, lysergic acid, diethyl diethyl diethylamide. So lysergic acid diethylamide, in short known as LSD, is a hallucinogen which is obtained from a fungus known as ergot. It is obtained from a fungus known as ergot. So it is a very powerful, it is the most severe hallucinogen. It changes the thoughts and perceptions of the person who takes it, right? Other hallucinogens, they include charas, ganja, bhang, hashish, or it is also known as marijuana. So other hallucinogens, they include charas, ganja, bhang, hashish, also known as marijuana, right? So there are other very potent these hallucinogens. This charas, ganja, bhang, hashish, or we call it as marijuana, they are obtained from the leaves of a plant known as cannabis plant. They are obtained from cannabis plant. They are obtained from the leaves of cannabis plant. So these drugs, they cause hallucinations. Hallucination means change of perceptions. They become far away from the reality. They get far away from the reality. So they are not able to perceive the reality. So for that reason, they claim hearing colors and seeing sounds, right? For that reason, inanimate objects, non-living objects, seem living to them, right? So they cause them these hallucinations. They also give them nightmares. These drugs, they also give them nightmares. So during sleep, these people, they suddenly wake up and they appear to be very much horrified. So they have seen a very bad dream. So this very bad dream, it is known as a nightmare. They give them floating sensations. These persons, they feel floating. They give them floating sensations. Hallucinogens give them floating sensations. They feel floating in the air. They feel that they are not walking on the land, but they are floating in the air, right? So this is again a false perception. It is again a change in perception. So their misuse of these hallucinogens, it also causes very severe problems. What severe problems does this hallucinogen misuse, its abuse cause? These hallucinogens, their misuse may again cause neuritis, it may cause neurosis, it may cause psychosis, it may cause schizophrenia. So these hallucinogens, they are also very harmful for the body. They may lead to neuritis, neurosis, psychosis, schizophrenia, right? So a person may suffer very severely, and they too have got very adverse effects on the brain of the person. So these are the four classes of these habit forming drugs or addiction causing drugs. So they include sedatives and tranquilizers, opiate narcotics, stimulants, and hallucinogens. So one should avoid taking these drugs because they are habit forming drugs and they are likely to spoil the life of the drug addict, right? So now question arises, how we can prevent the misuse, abuse of these drugs. Prevention or control of this drug addiction. So we can prevent or control this drug addiction to a greater extent by organizing by organizing awareness programs in schools, colleges, universities. So we can reduce this menace of drug addiction by organizing awareness programs in schools, colleges, universities, where we can aware the students about the harmful effects of this drug addiction, how it ruins the society, how it destroys our youth, right? So if we make our students aware about this, so they may stop using these or they may keep themselves at bay from using these harmful drugs, right? We should launch, we should launch a campaign in media against drug addiction. Media can play, print media, electronic media, social media, it can play a wonderful role in stopping this, in minimizing this drug addiction. So if programs are delivered through TV, through social media, or through radio on this drug addiction, then that may also prevent our youth, that may also stop our youth from going towards this drug addiction, right? We should impose checks on drug trafficking or smuggling. So administration, particularly police, they can play a vital role, they can play a pivotal role in minimizing this drug addiction. If police and the other administrative bodies, if they impose a severe check on this drug trafficking, this drug smuggling, then it will limit the access of youth to the drugs. So our youth, they will not be able to get these drugs so they can be saved from drug addiction. Similarly, parental guidance. Parental guidance is of pivotal importance. Every parent should keep an eye on the activity of his daughters or sons. Drug addiction is not only confined to boys. There are many females who have also become drug addict. They use these drugs, right? So it is a common problem in both men and women. It is common problem both in male and females, right? So boys and girls, they are equally attracted nowadays to this drug addiction. So parental guidance is of very important